Hey, everybody. So good to see you all. I've got Chris and I've got Thea and myself, all from our PH Ally, and talking to you guys about a little bit more about walkouts today. I know it is a subject that we all deeply care about that's impacting our profession. And interestingly, Thea and Chris have some very interesting backgrounds in current working environments that look at workflows. And I think when we really boil things down into what is going to happen with these next steps of walkouts, it's going to be some drastic changes to workflows for pharmacists and pharmacy technicians. I'll hit the reel and we'll get right into the subject matter that we want to discuss. Talk to you in a second. Chris and Thea, so good to see you guys. Have you guys been keeping up? I know you both have, but have you guys been keeping up with the things that are happening in Kansas and Missouri, right now? And I know I just talked to Marina and talked to Lauren about it a little bit, but I wanted to give you guys the stage, just to talk about some of the things that you guys are hearing and or seeing and your overall thoughts with what that's going to mean for kind of the future of the profession. I'll start with Thea to kind of jump in on that information.
Yeah, I think right now what we're seeing is change, right? All kinds of change. And that's like the inevitable future of everything is change. And unfortunately, we have to disrupt what we know in order to change. And if we don't do that, we'll stay in the same rut. And so I feel like what we're seeing right now has been a long time coming. A long time. Like the workflow dynamic of where retail pharmacy is not an overnight switch. It has been 10, 15 years in the making of more. We need more from you. We need more from your technicians. We need more volume. And it was about prescriptions before it was really about flu vaccines, right? Like flu vaccines came out, pharmacy started doing them in 2015, maybe a little earlier than that, maybe 2010. Somewhere in there. And so prior to that, you were just worried about your volume and what that could look like from a prescription standpoint, not even vaccines. And then you add vaccines and it's like, okay, one vaccine, flu, okay, I can do it, and that workflow changed a little bit. And then all of a sudden now we have a pandemic and we're the front line and COVID. And now we've got flu and COVID and RSV and all of these vaccines, and the volume metrics just keep growing, in addition to our prescription volumes that they need us to keep measuring and moving the needle on. And so I think change has been coming for a while in what the requests are, but I think that it hasn't been an overnight disruption. But I stand behind those pharmacists that are taking a stand and saying, we can't do more. This isn't what we are meant to be doing. We are healthcare professionals with a PharmD, most of us, that are standing up and trying to advocate for our patients, and you're not allowing me to do that. And where are we standing in front of the healthcare system? How does that stand in front of the healthcare system and growth and what patients need? It's not meeting our patients where we need them. Chris, what's your thought?
Yeah, I appreciate that. And I appreciate your thoughts. All very valid points, right? I agree with you. This has been a long, long time coming, right? You've seen pharmacists been asked to do more, but with less help, right? So less technician hours, less pharmacist overlap. And at one point, it's just a huge bottleneck that is bound to break, right? And so what I've seen so far is, a group of pharmacists that have really kind of stuck together and said, hey, we've got to take this profession back, right? We've got to, kind of combine forces and really get what we need done and be able to take care of our patients better. Because that's what we want to do at the bottom line, right? The end of our job is, we want to be able to say that, hey, we gave it our all to take care of our patients and, for the best possible patient outcomes. And where the future goes from here, I think it's unfortunate that it had to come to walkouts, right? And sometimes maybe people weren't listening or the stage wasn't set right to kind of have that proper dialogue. But now that it's come to this, there's threats of more, right? Unless real change is happening. And so it's up to, the executive team now to really kind of put their heads together and give them the change that they want, right? Because I think this is only the beginning if it keeps going.
Yeah, I think you're right, both of you, that you really called out that this has been a long time coming, and Chris, that this is an element that's evolving, rather rapidly kind of right now. So when it comes to those things and your guys' experiences overall, how would you differentiate, just to give us kind of like a ground level setting? When it comes to workflows in these various environments, I know that both of you have kind of diversified work experiences. When you guys have looked at workflows that were very successful for the team and those that were not successful, and kind of looking at what these folks are experiencing in Kansas and across the nation inside of these large retail chains that seem like they're struggling to do the basics, right? They're struggling to be able to take care of themselves and their patients, which is a real alarming component. But I'd love to hear your guys' thoughts. And Chris, I'll start with you on just what workflows have you guys kind of seen, and what workflows do you feel like are very broken inside of this current system?
Yeah, when it comes to specific workflows, I think the most important part, and being in the home infusion industry for quite some time in the hospital industry, is that we've been able to see everybody kind of work to their highest level and highest degrees, right? And so all the order entry, things like that, it's not always done by a pharmacist, right? We rely heavily on our pharmacist technicians, more than capable of providing, their order entry and things like that, right? And leaving the pharmacist to be able to kind of work up to their highest level, doing more clinical monitoring, clinical adherence things, talking with physicians, and really taking care of that interdisciplinary team. So I think, when everybody works to their highest level, you get a lot more better results, right? And then everybody's kind of responsible for their own output, and everybody has that responsibility, right, to the team. That's what I've seen kind of work the best. And then, the ones that are most broken, the workflows that are broken and fragmented, right, are just a very not clear delineation of duties, right? So everybody's kind of mixing and matching. They're all stepping over each other's toes. And I think that's kind of what you're seeing, right? Because, in a retail setting, it's not a closed door pharmacy. You've got the drive-through coming up. You've got patients coming up. It gets to the point where everybody's having to kind of, juggle a lot of positions right at once. So.
No, I think really well said. Thea, what about you?
Yeah, I think I agree. I mean, I think that when you're working at your highest potential and every team member gets to make that contribution at their highest level, I think you can keep the policies, the workflow, and the procedures very simple, but assignable to that person so that there is constant continuity of whose job is it? Because if it's everybody's job, it's nobody's job. And so when you can delineate that and keep that very simple and say, my order entry is now done by technicians. This is the requirement of a technician, and this is what they're going to do in their day, and keep it very simple and very straightforward and very, very transparent. That seems to drive the needle further than I've seen very complex, policies and procedures in the hospital setting are like daunting, but if you know them and you can reiterate everything in them, then you have what the organization is doing. But when you overcomplicate those, it really becomes just murky water, and you don't make progress at all. And so I say back to the keep it simple, stupid model of policies and procedures to be able to give you a workflow that's going to work for you, allowing us all to contribute first off, because I think COVID has taught us that we all need to show up and give what we want at the table and to contribute. And I don't know that a lot of executives are hearing that. And so when I'm allowed to contribute and there's workflow that wants me to contribute, man alive, wouldn't that be amazing?
Yeah, I want to add on real quick to that. That's a great point. And one thing I wanted to really touch on is I think the best things in pharmacy that I've seen is when people do kind of look at their processes, right? Whether it's every 2 weeks, every 4 weeks, and kind of make iterations and changes to make that workflow even better. That's something that not everybody always does, right? We're always kind of busy in the hospital. We're always busy in our pharmacy settings, but really taking that time to kind of look retrospectively, saying what can be done better, how can we iterate, and how can we change? That's really going to lead you kind of to the path to success.
Yeah, I think that's a great point you make there, Chris. And I love your thoughts there, Thea, on just really finding a way to standardize and recognize what is someone's job, in general. And I think the difficulty that we're seeing now, Thea knows how much I love analogies, and Chris will soon, I guess, understand that. But I really think of it this way. So my grandfather, he worked on irrigation, like large scale irrigation across the reservation. And so really finding ways to make farming more actionable across a large area. And so one fascinating thing is When you irrigate, you have a water source, right? That's pushing water across. You're opening up one water source or another, and it's flowing into fields. And you're trying to do it in a timely manner. You're not trying to flood fields. You're not trying to overwhelm, your canals and other systems. But I think what is happening inside of these individual systems is the dam has broken. Like we're just literally letting it all flow in. So even if we know our processes and we know our systems, we're getting overwhelmed that we're always looking for, I need somebody because my processes and systems only have this capacity. And now I have even more, that's being pushed on top of that. And so I understand that not only one, is that dangerous, for the individuals that are being served, because we can't forget this is healthcare and medicine is poison. And so those things have to be, I guess, highlighted once again for everyone out there. And then two, when it comes to us actually doing the things that we love to do, guess what ends up going by the wayside? Oftentimes, all of that clinical service, everything related to taking care of the patient, because we're now focused on getting product out the door, right? And so that was one thing I wanted to bring up with you guys is a model, a couple different models, but one that we'll start with is from some friends up in Canada that they've really found a way to, granted some of the structures and reimbursements are different, but we'll talk about that a little bit further. But what they've done is they've taken the pharmacist and had the pharmacist literally turn their back on the prescriptions so that they could focus on patient care, all the elements and nuances of patient care. It's just not them going and reviewing charts, but literally getting to know the patients, connect dots with patients, help patients with levels of optimization for their med regimens, other elements outside of pharma modalities to be able to help with their health, et cetera. And who's back there working on the prescriptions that are absolute experts at doing it? Rockstar pharmacy technicians, that don't need the pharmacist to help them with these things that they're already really, really good at. So that's the way that they've kind of pivoted things so that pharmacy technicians know that they've got the purview and the skill set and the allowance or credibility, from a higher source to say, this is yours to deal with. You don't need the pharmacist to help you with these things. That's your world to take care of. And pharmacists, those folks out front that come into the store, that's who you're focused on. Every single day is serving them. One interesting thing on that, they do have reimbursement models that are put in place for them to be able to take care of those patients and actionably make money back. Ties in really well to what Thea and I talk about all the time related to remote care services. And then once again, leveraging those instant to billing capacities and others. But anyway, just mentioning that, I wanted to get your guys' thoughts on that model in general, how it may translate into some of these retail and chain environments and things that may need to be done so that could be realized inside the United States. Chris, what do you think, buddy?
Yeah, excellent points. And, that model really reminds me of everybody just working to their highest level, right? We've talked about it a little bit in the beginning of the show, but, people are very, they crave responsibility, right? You want to be able to have that purpose in your job. And so, us as pharmacists, we want to work to that highest degree, highest level. We want to do that clinical monitoring and get to know our patients and, really provide value to them in that way. And technicians also, they don't want to just, dispense, right, or fill something, right? They really want that extra responsibility. And whether it's a tech or something like that they have, I think that model is definitely one that we may really see kind of becoming adaptable, right? We've seen a lot of that in like the ambulatory settings, hospital settings. Yep. Retail's always been a little bit different, I think, from that standpoint. And I think the biggest point of contention may be the liability sake, right? Of, what happens if there's like a wrongly dispensed medication. So I think, there's some things to work out there, but, besides that, I'm all for that model, right? So.
Love it. How about you, Thea? What do you think about the nuances there and what do we need to do to make that a reality?
I think it lends itself to zero transaction in all care and put that back into healthcare in our communities, which is huge here. You and I both know, Kevin, that, rural America, there's not a lot of health opportunities here. We're 45 minutes to an hour and a half away from specialty and ERs for some places. So, I think it really would allow us to be the healthcare hubs. And I think that's what when we heard maybe just before COVID was hitting how CVS and Walgreens were putting in the minute clinics, I think that was where they were going. I think they were trying to get there, but they didn't put pharmacy first, and they lost focus from my perspective anyways. I think they lost focus on who is the person that has that relationship with the patient, and that they weren't included in those minute clinics to be able to pull that relationship. That transactional relationship is something, but it's not going to be anything if these patients don't know those providers in those minute clinics and having to reestablish rapport with that patient. And I think that when we look at that model of less transaction and more care, I think it's an amazing opportunity to grow, especially those pharmacies that are going to be left after all of these closures and walkouts. And, it's not just the walkouts. I mean, Rite Aid is closing due to bankruptcy. Half of their stores are, 500 of their 2,000 stores or something in the next year. So, what are those jobs going to turn into if we don't look past transaction and look into where we can make a difference in healthcare? And I think less transaction and more care is where it goes.
Yeah, no, I totally agree. And I think on the transaction standpoint, we all know, including the viewers, thank you guys for being here with us. If you have any questions or thoughts, please just chime in. But we all know that the transaction still has to occur and has to occur safely, right? That still is part of the overall equation, is we have to have a way of taking a diagnosis and a treatment plan and delivering that to an individual in a safe capacity and manner, right? And so I think there's a lot of technology that we know is going to be coming around the brink. And I think that we've seen innovation before. If anybody's familiar with agriculture or manufacturing innovation, oftentimes you look at something that's a high FTE force that gets reduced FTEs and more technology gets injected. I've seen systems that are inside of FQHCs and other systems that they're using large scale robotics to get these things done. That doesn't take away from the non-chronic acute care emergency need components that are necessary, like the minute clinic example you kind of gave there, Thea. But I will say this isn't only for those folks that think this is only related to retail pharmacy, like this is only the retail world. This is not only the retail world. I've worked with and I've talked with several institutions that are hospital based that literally have yanked their pharmacists off the floor to say, we don't want you to do any more clinical responsibilities, because the only thing the law says that you have to do for us is process and verify these scripts. So we're going to stick you in the basement. We just want you to hit these check boxes. We're going to let the other staff members handle everything else. So, I mean, that's literal. Like just a few years back, I was just talking to hospital administrators that had that mindset about the way that they would go about pharmacy. So in general, it's really about finding a way to balance the need to make the transactions happen successfully and to be able to deliver the clinical services at scale and through experts. So another thing I want to bring your guys' way is this. When it comes to the current models that are out there for prescription fulfillment, right? We have a number of them. A lot of them are like just-in-time filling, or oftentimes these are carrying cost-related elements. But some of them are, you have a patient come in, you're filling their scripts kind of day of, right? Others are looking at med synchronization programs, which Thea and I have talked about many times. You're trying to get all of their prescriptions synchronized on a single day. Some others that I think are even more innovative are trying to take the entire population base, synchronize all of them to a single day. So now you're able to really innovate. So seeing some of these models that are out there on saying, let's take that burden away from everyday fire drill kind of processes. Do you think that is something that really has to be considered by us as a whole, societally as well, to say, we can't just continue doing the old model of whenever you need it, we're just going to get it. We have to be able to move toward a more prioritized and or synchronized effect. Chris?
Yeah, that model is what you see a lot in the home infusion setting, right? Their home infusion pharmacies are very good at prioritizing their chronic patients or patients that are already on service, right? So we look at TPNs, we don't want to set up the TPN compounder every single day if we don't have to. So, if we set it up Tuesday, Wednesday, Thursday, then we know that it's going to be our heavier days, right? But it's all about what you said, right? Planning and prioritization. So then when you do get those acute patients that come in or the same day referrals, not everybody's swamped to have to, kind of drop everything they do and create bottlenecks elsewhere. So yeah, I think, when you look at retails especially, I think that's definitely a good model to go and doing the best that they can, right? On that way. I've seen I've seen a lot of retail pharmacists stay late at night just to kind of get ahead for the next day. And that's a little unfortunate since it's outside working hours. But I think there's definitely innovation there that can happen to sync all their meds on certain days, right?
Love it. Thea?
Yeah, I would just say, I think with COVID making the disruption that it made on all of us from a workforce standpoint to all of it, I think that now is the time to change to a model that is going to service pharmacy, because we have the time of saying, okay, I'm short staffed right now. Please give me a minute. Please be patient with me. How many signs do you see in the drive-through of every store? No staff. Please be patient with us. Have a great attitude. Kind of things. And I think that if we got away from the model of instant gratification and satisfaction and went to a model of understanding, that may change the model from a society, right? Not necessarily just, healthcare society first off, but then a patient population too, that's understanding of the demands of the pharmacy are very high, and the education needs to go out on that to the patient level. But if that's true, can we get to a place where it's not an instant need, except for the occasions, but we're on a system, we're on that workflow of providing care for you, but it's not on the time you need it. And I think COVID has allowed us to see a model like that because of unforeseen circumstances of COVID and short staffing and all of that problem. But I think now is a great time to implement programs that you can put days ahead work and not be the rat race of every single day, and really start prioritizing the work that is coming each and every month. Why not get it organized for you to have the best day possible? And that is workflow and technology and optimization 100%.
Yeah. Absolutely. Yeah, I think that, covering a couple interesting model nuances. I saw that Thomas put on there, what is the role of mail order to reduce transactions as urgent or immediate? And I think we can take that in a couple different ways, Thomas. So if you want to plug in some additional details, then let us know. But when it comes to mail order and talking about either remote or decentralized filling, operations, you see folks like Costco, I know does this, and several other large organizations. What they try to do is take off some of the burden from the staff on site and be able to do some of those chronic med filling pre and ahead of time, and then get that to the site already prepackaged, bagged, and done, right? And so I think that can be really helpful. I think that mail order can also be able to help, with that exact same space. We talked about the med synchronization element, and even though it would push a lot of acute care toward the retail fronts of individual pharmacies, that's what we're there for. We're there to be able to take care of those individual needs, and without the burden, the prescription burden of everything else, chronic disease state related, would be significant to be able to take some of that off. Some interesting things though to pull in there, and I'd like to get Chris and Thea's thoughts on this, is maybe one thing that Thomas is saying, or maybe I'm just saying it, is that sometimes mail order can cause some of those issues with urgent and immediate need. I didn't get my drugs, and now I need them right now because I'm out of them. Or mail order is not taking care of all the other medications that I need, my antibiotics, my pain medications, et cetera, right? And I need those immediately from the pharmacy, and you don't have the relationship with those patients previously. We just once again broke open the dam because you have a brand new patient, you have no idea about them, and now they're coming at you for immediate needs. Your guys' thoughts on how can we collaborate or get more information to be able to connect the dots between mail order or these outside pharmacy systems and the inside pharmacy systems? And second is really this: working remotely and in rural settings, I've been exposed to telepharmacy systems, like telepharmacy as in Chris is able to come into my pharmacy remotely via video, work with my technicians, talk to my patients, right? And that's only allowable by law in a few different settings. And I'm really curious, the leveraging a pharmacist inside of that to be able to flex into some of these spaces, and how much burden that may end up taking off. Once again, there's some legislation, components in there. So questions back to you guys, just to get a synopsis. When it comes to mail order, how can we do better with working with mail order? And when it comes to telepharmacy options, how can we start integrating that if let's say it's legally available? Chris, you want to start?
Yeah, I can do my best here. How do we integrate better with mail order pharmacies, right? Well, one, I think, you've got to be able to share data in a compliant way, right? So if you do have those kind of times where somebody didn't get their mail order drugs or something happened there, right, then you can take a quick look at maybe their medication profile, right? See, kind of get a little bit more notes and things like that of what they're really what's going on with the patient. And I think that's going to be really helpful using kind of technology to do that. Another thing I do want to just kind of step back here and say is, going through that centralized model, right? Having mail order sends all the chronic drugs, and then maybe your retail store is kind of doing the more acute side of things. Even if you go through that model, I think we would be very likely to see a little bit of a drop off, right, between how much they're busy by, because even if the mail order gets 80% of the drugs right, or 80% of the medications to the patients, that's taking a huge burden off the retail pharmacist. And I know there are some retail chains that were working towards that centralized model. Your second question, telehealth, how can that benefit? That's huge, right? Just being able to have a pharmacist kind of stand by, or having one pharmacist in your district, right, that can handle all those patient consultations. Now, there may be some things that need to happen, like a scheduling kind of point of view, but in that instance, alleviating that burden off the pharmacist who's actually in the store would be very beneficial. And I think that's something that, I think a lot of retail pharmacists could really benefit from, right? And I think patients can as well. And, they would, if the help is there, they're willing to ask the questions.
So true. Thea, how about you?
Yeah, I mean, I think I go back to this question of technology. How can we help it? And, working independent retail for, ever, and just floating in and out, seeing the different point of care service, purchasing through the pharmacy systems, right? I've used all different kinds of software systems in pharmacies, and from the good to the not so good, and still today, anyways. When you look at what the Cadillacs of pharmacy software is able to do today, like, I don't even have to find what that person's insurance is anymore. It does it for me based on their birthday. Like, who does that? Like, if they know that much information about it, why don't we have more technology behind us and sharing of more information? Because that is commercial grade insurances are in there. Medicare is in there. All of them are in there. So how is that in that one software system? But then there's other systems that can't even function on a clinical level at all. It's just transactional pharmacy dispensing. And so I'm like, where can we bring the collaboration between pharmacy services based on, here, I am supporting my mail order folks because I now can see what's going on at the mail order. And it's not like accusations going back and forth between retail and mail order saying, well, they did this wrong or they did this right, and whatever. It's being transparent and being able to see it. And I don't understand why the pharmacy technology hasn't caught up to sharing that across all pharmacies. We are all HIPAA compliant and we all can see it and we know how to handle it. So let us. And, if you can have commercial and Medicare and federal government insurance on this platform, then why can't I see their refills? Why can't I see what's going on? Why do I have to go to another system to process a controlled substance? Why can't I see it? Like, we're making this so much harder than just sharing across HIPAA compliant opportunities. And I think that based on mail order to retail pharmacy and how that could lift, I think it would be an amazing opportunity to see that come full circle, because it would take the guesswork out of it and really support our patients and coordinate the care, which we talk about all the time, Kevin, based on all of these care management services that I know, love, and trust. Like, we see it. Coordination of care is the number one reason Medicare is throwing money at this like crazy. And yet pharmacy can't even coordinate the care between two different pharmacy dispensing models. Like, come on. But I think technology is the biggest thing. And I think Chris hit that right on the head there about how we can move that forward. So, I mean, I think that there's a lot of room and growth. From a telepharmacy standpoint, I think I'm all in. Like, it's my wheelhouse. I love telepharmacy and all the services that can be provided. And I think, working for several different independent pharmacy owners and being able to augment them and help them because they need help because of a staffer didn't show, or they have clinical work, or there's these contracts that they could be doing and they're not doing, and all of that could be happening via telehealth, telepharmacy opportunity is amazing. And I can't wait to see that change and grow as well.
No, totally agree. So to close things out, I know we're running up on time, guys. Just wanted to hear from both Chris and Thea on just any last words for the folks that are in the walkouts, the folks that are frustrated with kind of the career movement and how the workflows seem desperately broken. And any thoughts for them? Any encouraging words before we say goodbye to the audience? Chris, I'll start with you first.
Yeah, absolutely. You know, keep advocating for our profession, right? This is what our profession needs. It's unfortunate that it's had to come all the way here. But, you know, keep having those open dialogues, right? Because that's really what's going to push a profession forward. And for everybody else, so all the other pharmacy organizations, you know, this is a time where we can really rally around all of the pharmacists, right? And really push pharmacists to getting to that next level. So yeah, my only words are just really encouraging, you know, the correct dialogue to happen. And, you know, we're all with you guys. So.
Amazing.
Yeah, 100% support the movement for sure. Being a pharmacist that has worked the gamut of all kinds of pharmacy, I think the biggest thing for me when I look at all of this and how leaving moments for those that may be in the middle of all of it is, you know, when I come to a crossroad, I always try to bring with me what would make it better. Is there something that you can bring to the table to share? Because walking out is one thing, like a disgruntled employee, I think, you know, like I've had several of those in my career, and it doesn't help just to be disgruntled and walk away and throw your hands up and say, no, I have nothing. I'm done. I'm just done. But that doesn't serve anyone. So I say, I think we need to advocate for our profession, but we need to come to the table with something. Like a good negotiation would for any business across any industry, to come to the table with what is it that you feel that could make the difference. And I think, Chris, you hit this right on the head, is we have to bring it from an organization standpoint. We don't have a really strong across the nation organization that can stand up and talk for us. We've got lots of great ones, but not one like that's taking the lead and really charging forward with any of the advocacy for our profession. And I think it's going to take a lot of us and a lot of organizations to stand up and bring some value to the table for them to be able to make change, because they're going to make small changes because they think it's the right thing to do, but it's not going to be enough. And then what, you know, but I didn't bring anything to the table. You didn't even offer. So I say be proactive and bring some concerns to the table, but also bring some solutions as well, because that's the best part of negotiation right there.
Yeah, I'm just excited that this very brave group decided the lip service was over, right? Yeah. All the talk is done. Let's get something to actually happen. And I think that is a push for all of us as pharmacists, all the pharmacy organizations, that putting letters out there and documents of support, like, that's great. Okay. Where are we going to really put our foot down and make some actions happen for our profession and recognize some things that need to occur? There are other organizations that represent other professions that have done that time and time again. If you like them or not, guess what? They stand up for their profession. Mm-hmm. And I'd love to see that from our group collectively and start having a collective mindset on here's how we can do some things. Thank you guys both for all your insights today. Really appreciate it. Thank you, audience, for everybody that's been there. Thank you, Thomas, for those comments that you threw across, and everybody else. You guys have a wonderful rest of the day, and we'll talk to you soon.